Hi everyone, my name is Chris, and today I will be presenting on amyotrophic lateral sclerosis, or ALS, which is also known as Lou Gehrig's disease. In this presentation, I will be covering what ALS is, how it affects the body, who it impacts, how it is diagnosed, and how exercise treatments can help patients manage their symptoms. ALS is a serious neurodegenerative disease, and even though there is currently no cure, understanding it better can help us improve quality of life for patients. What is ALS? ALS is a progressive neurological disease that attacks motor neurons in the brain and spinal cord. Motor neurons are the nerve cells that send signals to voluntary muscles. So when those neurons are damaged, the muscles stop getting the messages that they need in order to work properly. As the disease continues, muscles weaken and begin to atrophy, which means they begin to break down over time. Eventually, ALS can affect the muscles used for speaking, swallowing, and breathing, which is why it can become so serious. Anatomy and physiology. To understand ALS, it helps to know that it affects both upper and lower motor neurons. Upper motor neurons are involved in sending movement signals from the brain, while lower motor neurons carry those signals to the muscles. When ALS damages these neurons, movement becomes harder and weaker. The nervous system can no longer communicate normally with these muscles, and the loss of signal is what causes the physical decline seen in the disease. Prevalence and epidemiology. In the United States, about 30,000 people are living with ALS, and around 5,000 new cases are diagnosed each year. It is most commonly diagnosed in people ages 40 to 70. ALS is also more common in men than women. Another challenge of the disease is that only about 5 to 10% of these cases are familial, meaning inherited, so it can be hard to predict who will develop the disease. Life expectancy. ALS affects life expectancy differently for each person, but on average, survival after diagnosis is about 3 years. Some people live longer, especially with good care, symptoms management, and a supportive treatment. This is one of the reasons why ALS is considered such a devastating illness. Even though it progresses differently from person to person, it is still a condition that can seriously affect independence and daily function. Causes and risk factors. Most ALS cases are not inherited, but genetics can play a role in some patients. Other possible risk factors include exposure to heavy metals, military service, or smoking and/or secondhand smoke exposure. Researchers are still trying to fully understand why ALS develops because the causes is not completely known in most patients. Prevention is difficult, and that makes early recognition and treatment even more important. Signs of ALS. Some common signs of ALS include muscle weakness, muscle twitches, fatigue, trouble speaking or swallowing, and shortness of breath. These symptoms may begin subtly, which is why ALS can sometimes be mistaken for other conditions early on. As the disease progresses, the symptoms become more obvious and begin affecting everyday tasks. Patients may notice that they get tired more easily, have trouble with fine motor movements, or struggle with balance and coordination. ALS progression. In the early stages, people often notice weakness, cramps, and problems with fine motor skills. In the middle stage, walking and speaking can become more difficult, and in the late stage, the person may become more dependent on others for daily care. In the end stage, the muscles used for breathing, including the diaphragm and intercostal muscles, may no longer work well, and at that point, some patients may need a ventilator or some sort of support to help them breathe. Diagnosis. How is ALS diagnosed? ALS is usually diagnosed by first doing a neurological exam to check strength, reflexes, and coordination. Doctors also diagnose it by ruling out other possible conditions, since there is not one single test that confirms ALS immediately. An EMG can show abnormal communication between nerves and muscles, and an MRI may be used to rule out things like tumors, so diagnosis is based on a combination of findings rather than just one test alone. How ALS affects and is affected by disease. Exercise can be helpful for people with ALS, especially in early stages, but it has to be done very, very carefully. Light exercise may help maintain function, but overexertion can cause fatigue, weakness, and much worse. As the disease progresses, the focus changes from improving performance to maintaining safety, comfort, and independence. That is why exercise plans for ALS must be adjusted based on the person's current stage and their abilities. Medications and research. Riluzole is one of the main medications used for ALS. It is not a cure, but it can help slow motor neuron damage, and it can also delay progression. Common side effects include nausea, stomach pain, fatigue, elevated liver enzymes, and less commonly breathing issues and/or liver injury. Endeavorin is another medication that may help protect nerve cells from further damage. Some side effects include bruising, shortness of breath, and trouble walking, which should be discussed before an exercise program is written. More serious issues may include swelling and difficulty breathing. Research is also still ongoing for gene therapy and stem cell therapy, which gives us hope for possible future treatments. In this case study, John Doe is a 62-year-old man in the middle stage of ALS. He has muscle weakness, fatigue, and loss of balance. He also uses a cane because walking long distances can be a challenge for him. His main goal is to keep his independence, improve his mobility and balance. He would also like to reduce fatigue during short daily tasks. These goals are realistic goals that are important for maintaining John's quality of life. Exercise test results. John completed a 6-minute walk test and covered 220 meters using his cane. During this test, he took one seated rest break, and after the test, his heart rate rose to 112. His oxygen saturation dropped to 92, and his perceived exertion was a 14 out of 20. During his timed up and go test, he took 15 seconds, which does suggest that there is in fact a fall risk. With his grip strength, that was also reduced with 21 kilograms on his right hand and 18 kilograms in his left hand. And during his single leg stance test, his results showed that there was poor balance, especially on his left side. Based on these results, John should participate in aerobic exercise about 3 days a week at light intensity, around an RPE of 10 to 12. Sessions should be kept short, lasting around 10 to 20 minutes to avoid overexertion, fatigue, and allow gradual adaptation to exercise. Low-impact activities like stationary cycling, assisted walking, or treadmill walking with support is most appropriate for him because they place less stress on the joints while still improving cardiovascular endurance and circulation. As tolerance improves, the duration of exercise can increase slowly over time. For resistance training, John should exercise about 2 days per week at a very light intensity using seated exercises, resistance bands, or light free weights. The focus should be on maintaining muscular strength, improving functional movement, and support daily activities rather than lifting heavy or high-intensity training. Exercises should also emphasize proper form. He should have controlled movements, and he should also be taking adequate rest between sets to reduce strain and also lower the risk of injury for him. Balance training should also be included several times per week to help improve stability, coordination, and fall prevention. Simple activities like sit-to-stand practice and supported single leg balance exercises or controlled stepping drills may be beneficial for him. In addition, flexibility and breathing exercises should also be performed daily to help maintain joint mobility, posture, and respiratory function. Gentle stretching and diaphragmatic breathing exercises is also super important to reduce stiffness, improve comfort, and support overall quality of life. Some other recommendations include making home wheelchairs accessible, or making the home wheelchair more accessible, using simple energy conversion strategies like pacing activities and taking rests when needed. Staying cool and hydrated is also important to reduce fatigue during daily activities. Balance support and fall prevention is important, including removing hazards and using assistive devices, ensuring safe walking or transfers. Caregiver support is also super important and should be available whenever needed to assist with exercises and daily tasks for safety for someone living with ALS. And in conclusion, ALS is unfortunately an incurable progressive neurodegenerative disease, but with diagnosis and medication, a light exercise program can help slow the effects of ALS, helping improve quality of life as well as maintaining physical function as long as possible. It's very important that an exercise program for this individual is carefully constructed with all considerations in mind to prevent risk of injury or possibly worsening their symptoms. And although ALS will continue to worsen over time, medications and exercises can help assist individuals to maintain quality of life and remain active while this disease progresses. Thank you.